There is a National Association for Care Managers, and a lot of these people are former social workers or perhaps former nurses or nurse practitioners, and they're licensed and certified. I believe that there are care managers in every state. There are also nurse practitioners in every state. But again, we get into kind of the nuances of working in individual states in something called scope of practice. And what that means is that in some states, for example, care managers can do really a soup to nuts kind of approach and be an advocate and accompany a patient, for example, to a physician appointment and speak up. In other states, maybe they can drive the person there, but they might not be allowed in the room, which really doesn't make any sense if the person with Alzheimer's or dementia really can't make decisions for themselves. The doctor might not want to talk to the care manager, might only want to deal with a family caregiver. So every state is a little bit different, and it becomes really a roll of the dice. If you happen to live in a state where there's a wide scope of practice, you can get more services out of that. If you live in a state or your loved one lives in a state with a narrow scope of practice, you're still very limited in what can be done for him or her. Certainly the support groups are a great place to start. The Alzheimer's Association, the Family Caregiver Alliance, the Alzheimer's Foundation, AARP are 4 national organizations that have help and chapters in every state. So certainly that's one of the best places to start your search. And if they can't help you, they probably can refer you to other local organizations that can. Depending on which state you live, obviously a more urban location would have more resources available. In rural areas, sometimes you might have to do this online, you might have to do it by Skype, or you might have to do it in a chat room. But there is help available in every state. And I'd say those 4 organizations are probably the best to start with.